Good morning everyone, I'm Dr. Sushmitha. Today's topic of presentation is EWING sarcoma. Coming to the introduction, EWING sarcoma is a malignant tumor of the neuroectodermal origin arising within the bone or soft tissue. It is most commonly seen in children and young adults under the age of 20 years. It is characterized by morphological features of small round blue cell tumors and immunohistochemical features of expression of CD99 protein. Cytogenetic features of translocation 1122 or translocation 2122 gene rearrangement. Here is a case report of 20 years old male patient who has presented with complaints of forward protrusion of the right eye since 1 month. The forward protrusion was painless, progressive in nature, and it was not associated with headache, vomiting, or loss of vision. There was no history of trauma or any systemic illness. On examination, the patient was apparently healthy. Vitals were within the normal limits. Ocular examination, head posture was maintained, facial symmetry was normal. Extraocular movements were restricted in the right eye in abduction and elevation. Best corrected visual acuity for distance was 6/6 and near N6. The abaxial proptosis was noted in the right eye. This is abaxial proptosis noted in the right eye and restriction on elevation. CT scan orbit was done and it showed a soft tissue density mass lesion in the medial aspect of the extracorneal compartment. It was measuring about 3 into 1.5 centimeters and the mass effect was abetting the medial rectus. There was mild erosion of the ethmoidal sinus suggestive of neoplastic etiology, and a provisional diagnosis of rhabdomyosarcoma or Ewing sarcoma was made. Based on the progression of proptosis, that necessitated for early surgery, and the lesion was also well defined. The patient clearly explained about the pros and cons. Patient underwent right medial orbitotomy with mass excision and biopsy under general anesthesia. This is a picture of the excision biopsy. Histopathological report showed solid grey white lesion measuring about 2 into 1.5 centimeters, and on microscopy the tumor was composed of nests and islands of cells surrounded by dense hyalinized membrane with oval nucleus and coarse chromatin. And based on histopathology, the diagnosis was made as a neoplastic lesion suspicious of malignant round cell tumor. Immunohistochemistry was done in this case to further classify the small round cell tumors. CD99, NKX2.2 and Vimentin were positive, and cytogenetics showed rearrangement of ESWR1 gene, which was positive, and it was suggestive of Ewing sarcoma. On first follow-up, the wound site was healthy and anterior segment and posterior segments were within the normal limits. Patient counseled about the nature of the tumor, chances of relapses, and need for regular follow-ups. Patient was advised to consult the oncologist in view of need for chemotherapy, but the patient lost follow-up for 4 months. He didn't consult the oncologist for 4 months. After 4 months, the oncologist has done a PET CT scan which showed recurrence of the lesion. On examination, best corrected visual acuity was 6/6, but extraocular movement showed mild restriction. Patient clearly explained about the prognosis and referred to the oncologist in view of need for chemotherapy or radiotherapy. Patient has visited us after 4 months and the best corrected visual acuity was 6/6. Patient completed 6 cycles of chemotherapy, vincristine, actinomycin D and cyclophosphamide, 3 cycles alternately with ifosfamide plus etoposide. MRI orbit was done after 6 cycles of chemotherapy, which showed no evidence of residual or recurrent
Last
lesion.
minute.
Patient was advised adjuvant radiotherapy in view of high relapse rates in Ewing sarcoma. On the last follow-up, the patient completed chemotherapy and adjuvant radiotherapy. Best corrected visual acuity was 6/6, and there were mild side effects of radiation such as loss of eyelashes and punctal block. Repeat MRI scan was suggestive of no residual or recurrent lesion, and he is on regular follow-ups with oncologist and ophthalmologist. Coming to the conclusion, Ewing sarcoma is seen in the younger age group. Presenting as proptosis is a rare manifestation. It is known for its aggressive nature. However, in our patient, the tumor was diagnosed in its early stage and surgical excision was performed. He didn't have any systemic involvement at the time of diagnosis. He has received chemotherapy and adjuvant radiotherapy after surgical excision. Emphasis has to be made regarding the importance of regular follow-ups to detect early recurrences in such aggressive tumors. With appropriate management, there is likelihood of better prognosis, both in terms of survival as well as improved quality of life. Thank you.
Thank you, Dr. SUSHMITHA.